impact and refine the model even as we go forward. These are my quick inputs to you, and looking forward to wonderful discussion and guidance from you all as to how to refine our thinking and how we can work together to make AI for India happen, so that AI will help define India's future and AI will help define AI's future. Thank you very much. Jai Hind.
Thank you, Dr. Paul. As always, very insightful and impactful to start the discussion. Maybe then I will ask Mr. Aman Sharma. And the government has been on top of this, PRIP scheme being one example of how we incentivize creation of new technology, particularly to do with healthcare. What is the perspective that you would like to offer in terms of how the government looks at incentivizing tools, AI tools, development of AI tools particular to our country and our needs?
Thank you, sir. Esteemed panelists, ladies and gentlemen. Dr. Paul has very comprehensively covered the entire landscape of usage of AI in the healthcare sector. So I would just briefly touch upon 2 or 3 points. Of course, Dr. Paul has already mentioned about the role of AI in enhancing the drug discovery and primarily reducing the time span. Today it takes almost 7, 8 to 10 years to bring out a new molecule into the market after conducting all the clinical trials and make it available in the market. Now, with AI, I think that time span is going to get shrunk. I would say maybe we are looking at a time span of 5 to 7 years now. And of course, the cost of developing a new molecule also would come down eventually as AI enters into all the domains of drug discovery, be it, starting with a huge pipeline of molecules and then finally shortlisting 30, 40, 100 of them and finally going to the clinical trials. That the cost and time is going to get reduced. And another area where I think AI is already having a deep impact is how to make our hospitals more efficient. Right now, I think the government hospitals where the usage of AI in managing the hospital, I'm not talking about, maybe replacing the clinicians through the use of AI. That will take a lot of time because there are a lot of legal, moral issues involved in that. But a bare minimum use of AI to make the hospitals more efficient. I think that is where we need to really work on in the next 5 years, because it's a low-hanging fruit without, I would say, any regulatory hurdles or ethical, moral, legal issues on that. And if we are able to manage that, I think we can really reduce the cost of healthcare in the country. Government hospitals become more efficient, they are able to see more patients, and private hospitals, their cost of rendering healthcare also goes down. So that is an area where I think AI is really going to play a massive role in the coming years. And already we have the medical device companies, they are introducing more and more AI tools to make their devices more efficient. So already Philips, I was speaking to the CEO. So they have introduced AI in their imaging devices, and with lesser number of scans, less exposure to radiation if you are thinking of a CT or an X-ray. So with lesser number of scan, you actually are able to get the right diagnosis as to what is the issue like with that particular patient. So you are able to use the machines more efficiently. And if in a particular day you are using a certain scanning machine for say 20, 25 patients, you can maybe enhance it to 50. So that automatically reduces the cost of rendering these diagnostic services. So this is an area where I think a lot of work is already happening, and in the coming few months and years, software as a medical device is really going to gain prominence. Already we are having a number of startups in the country who are working in this area. And I think the floodgates are just about to open. So this is how I think we see the usage of AI to basically reduce the cost of healthcare in the country. So that is the ultimate takeaway for the government in this area. Thank you very much.
Thank you. Thank you. I think this is a nice segue to ask Nico a question about the use of AI in healthcare, particularly in the Netherlands. What are the key system enablers that you have seen that has enabled this to happen in a successful manner?
Thank you very much for the question. First of all, let me thank Philips for hosting this event. As you can imagine, at the Netherlands Embassy, we have a very special relationship with Philips, and therefore we are extremely happy to have the global CEO of Philips, Roy Jacobs, here in India. It's for various reasons. Just very shortly, Bharat, if you allow me, a very special week for us, because as the Netherlands, upon the invitation of the Indian government, we have been co-chairing the work group on AI for economic growth and social good over the past 3 months, I think. So this week is a very special week that a lot comes together in this week. I said co-chairing, that means that there was another co-chair, that's correct. The other co-chair is Indonesia, and I think this really shows very clearly how we can create alliances, like in this case between the Netherlands and Indonesia, coming together in this particular week. Now let me get to your question, obviously. Maybe just getting a little bit back, back in 2019 in the Netherlands, we had a national program called Valuable AI in Healthcare. There we stimulated, as a government, Ministry of Health, that I represent here, a lot of pilots on AI in healthcare, and also helping our medical institutions with ethical guidelines in AI. That probably explains why exactly 1 year ago, the WHO decided to designate our Digital Ethics Center at the Technical University in Delft in the Netherlands as the first WHO collaborating center on AI health governance. This is obviously worldwide applicable. If time permits, I'm happy to say more about what this WHO collaborating center on AI health governance is going to do and how it can help the entire community in the world to deal with the questions that Dr. Paul rightly set out from the start. Now, with this experience on our national program, Valuable AI in Healthcare, our Minister of Health sent a document, a policy note, a new strategy to our Parliament in October 2025. So that's still very, very recent. And that's called Realization of AI in Healthcare. Exactly what Dr. Paul was also stressing, the importance to get to realization. So with this new program, we are shifting our focus from experimenting with AI to implementation and scaling up of AI in healthcare. How are we doing that? By a two-track approach. First of all, stimulating innovation with AI by addressing 1, labor shortages, 2, medical needs. The second track is guaranteeing public values. We do that through legislation and in particular EU legislation. Very briefly on the EU, because that's very important for us, of course, as the Netherlands, being one of the founding members of the European Union, is first of all the EU AI Act. That's worldwide the first legal framework for AI or for AI systems. It's a risk-based approach, which is clear, subdividing in unacceptable risks, high risks, limited risks, or minimal risks. And that gives you clear guidelines for companies, for knowledge institutes, for governmental organizations. What kind of measures do you need to take? So it's not purely bureaucracy. It really helps you to get this level playing field, and in order to make sure that we implement AI in a responsible way. Now, this goes in parallel with the EU Apply AI strategy, when €1 billion have been reserved to do exactly what Dr. Paul was mentioning, speeding up the adoption of AI and also integration of AI in the core processes of different sectors, focusing on scaling up, so removing the obstacles and also allowing very much SMEs to apply AI in their processes. Specifically on health, Bharat, and I will end with that, is that this allows to streamline market access of medical devices with AI, without compromising on patients' safety. I will stop here, and maybe if there are questions later, I can go further in detail. Thank you.
Thank you, Nico. I think quite clear-cut, right, that you see actually it works when you implement it with the right boundaries and the right guidelines. That leads me to a very interesting perspective that I hope to get from Dr. Panigrahi. AI depends on the clinicians believing in AI as much as patients wanting to use it. In your diverse experience, and you've seen many trends over the course of your career, how do you place AI in terms of welcoming AI by clinicians? What are the concerns? How do you see that scale up in the clinician context?
Yeah, first I'd like to say thank you to Philips for organizing this. And I'll go back to the FICCI Heal, which happened a couple of months back. I think Dr. Paul very rightly mentioned that healthcare has to adopt AI. There's no stepping back now. So I think so, whether it's the public sector, private sector, I think so everyone has to start looking at it. And from Fortis perspective now, what we have started doing is that we have created a complete innovation cell headed by a senior doctor who is the administrator to see that how do we sort of adopt AI to make the patient's journey comfortable. So in other words, I mean to say that when the patient enters the hospital, they know that they have come to the right place, right hospital, the right doctors, so that that journey is important. So these things are now being built up by a chatbot, by a lot of digital formatting that's happening with the QR codes and all that. So I think so, just coming back to Philips, I think so, I was there in Singapore last week, and they have adopted a hospital which is a smart hospital in the sense that a lot of talking that happens when actually most important person in the hospital is the nursing. Nursing care takes about 70% of the healthcare needs. But if you look at across the globe, and more so in India, if I can put it, the nurses are called for a lot of mundane work, which is, they takes away time from their healthcare work that they should be doing. So this, what they have done is that, I saw it there, that the healthcare, a lot of things that are not nursing related, you can access it. And these have been made there. And these are the things that we're not implementing in our place also. So that helps the patient in the journey. We can spare out time, bring in efficiency at the bedside level care. So that's there. And the other part is that even now with the insurance things increasing, AI is a good tool to sort of screen through the insurance adoption. Essentially, these are the ones that we have done, and in the, I don't want to take steal Dr. Harsh Mahajan's thunder. In radiology also, a lot of things that he has done, we have started implementing it. So it gives us access to preemptive care in the sense that we pick up things much earlier. Earlier.
Thank you. I think this is very encouraging to hear the clinician's perspective and adoption. Honorable Ministers here, thank you, ma'am, for joining us today. We just have a couple more questions. We'll wrap up before we hear from the leaders, just 5 more minutes. So maybe I'll turn it over to Dr. Mahajan. You are very connected to the ecosystem of startups that are working on healthcare and AI. Can you give us a perspective of, what do you see? How excited are you about the future of AI in healthcare?
Thank you very much. At the outset, thank you, Philips, for having me here. And let me give you practical examples of what India has done in the last 10 years for AI in healthcare. It may surprise many to know that the first paper ever written in the Lancet on AI came from India in 2018, which means it was for critical findings on head CT scan of the brain, which means work was going on in 15, 16, 17 to be able to, have a product which could be used to detect automatically brain hemorrhage, midline shift in the brain. So it is great focus that the government is giving now, but in some part that focus, both by the government and startups and academia in this country had started when deep learning started in 2016. Two, if we look at government programs, then the TB program in this country, since over 2.5 years, with handheld X-rays and AI in a laptop, millions of people have been scanned, X-rays done, and with AI, what is done, you find out whether the X-ray is normal or abnormal. The abnormal ones are then taken up for the next level of examination, so that asymptomatic people at a population level, and remember, we are 1.4 billion, but this work is on district to district, village to village, town to town, this is happening. Another initiative, again, breast cancer is rampant all across the world, also in this country. What has been developed by one of the labs down south is a bra which has thermal detectors within it, which is able to pick up, again, at a population level. We have to think population level, and Dr. Paul very rightly mentioned that. This takes 10 minutes. The lady wears the bra. The signal coming from it goes to a computer, which uses AI inside. And this was about 4 or 5 years ago. Of course, it's still to be implemented at the practical level, because like it was said, validation has to be done at a large scale, and you don't want to miss cancers. But this is the initial level where those who have suspicion of breast cancer can be segregated from the thousands that are scanned and then sent for mammography and whatever else may be needed. This is what is happening in this country. What I feel, and I make this statement very responsibly, that if used ethically, if used properly, AI in healthcare can only be beneficial, especially if used under supervision of healthcare professionals and not by lay public at large, where they feed their data into ChatGPT or whatever and try to figure out what's happening. So that's very important. Then, as has already been said, already our CT, MRI, ultrasound equipments have AI inside, dose reduction of radiation on CT scans, faster, higher quality scans on MRI and ultrasound, and actually automatic recognition of lesions. And going forward, we have, like Dr. Paul said, we work in silos: pathology, microbiology, radiology, nuclear medicine, genomics, proteomics, metabolomics. It is only AI of the future which will be able to break these silos so that we are able to give pre-digested, if I may use that word, diagnosis to a person, to a doctor sitting in his clinic, to be able to treat. So I think the future is bright, and the youngsters of this country, I'm sure, will do what Dr. Paul wants from them. Thank you very much.
Thank you, Dr. Mahajan. And to wrap up the panel, question to Neeraj, my good friend. So in a resource-constrained environment, like you've seen many times happen, AI can be a force multiplier. What is your perspective on that? How can AI help in a resource-constrained environment?
Thanks a lot, Bharat. Thanks for having me here, respected Minister. Dr. Paul, of course, I always listen to you very carefully, sir. Every time I get inspired when I listen to you. An ex-boss of mine once said that it's not about AI and digital, it's about health. And I think that reminds me every day that let's focus on health and look at AI as a means to get there. And there's a lot of AI out there. In fact, the noise is getting a little too loud, I feel, especially under this roof at the moment. But I think really, if you think about the public health system and if you think about health equity, we are seeing a lot of bright, shiny objects out there. There are a lot of innovators doing some great work, but are they actually getting to what Dr. Paul actually referred to. Are they actually talking to the health system? Are they actually thinking about equity? And I think that's the direction we need to go. So a few things that we've actually found to be very important, and I want to send that message out. Firstly, building an AI system is not going to help unless you are embedding it in the public health workflows. And that's when we're going to see real impact. So how are they actually fitting in? Can they actually even be rolled out? Are they cost effective? Can they be used as triage tools? Not necessarily, a lot of people walk in saying this is a diagnostic, but actually maybe they just could be used as triage. Laws to follow up. TB especially, and Dr. Mahajan talked about that. NCDs, people, fall off the map. So that would really help the public health system. We need to build on digital public infrastructure. I think that's another big one. And Ayushman Bharat Digital Mission has really shown us the way. That's, to me, the gold standard globally. We need to build on that. We need to have, they've got open APIs, any of us can connect onto it. So unless we do that, data is not going to come together. The system's not going to come together. And I can see Bharat is nervous, so I'm going to go quick, Bharat. Give me another 2 minutes, all right? We need to design for low resource settings. AI is not only a tool for rich people wearing those great, nice watches. I still wear an old analog, but, those digital watches which are telling you every minute what's happening. Let's design for low resource settings where resources are scarce, including government resources, all right? We've got to prioritize. So let's try and design so that they're cost effective, both in terms of usage as well as in terms of the equipment itself. Finally, the frontline worker who's going to use this, let's not burden them, and we are burdening them. All the technology that's going out there, when we go out into the field, we find that people are just layering technology after technology. And I think, NGOs like us do that more than anybody else. So I think we are actually, to some extent, to blame. But decision support systems have been very useful. For the frontline worker, if you've got a decision support system which is guiding them. And finally, we have to have governance at the center of it. We need to have validation. We need to make sure that humans are in the loop. So I'm going to stop there and hand back to you, Bharat. I think it's time to walk off the stage.
No, I think, so first of all, appreciate the enriching discussion. We're going to hear more from everyone. Thank you. Over to you, Jude.
Thank you. Thanks to all our panelists. Please stay back on stage. We do have a group photograph. But before that, I would like to invite Mr. Roy Jacobs, Chief Executive Officer, Royal Philips, on stage, and join me to welcome Srimati Anupriya Patel, Honorable Minister of State for Health and Family Welfare and Ministry of Chemicals and Fertilizers, Government of India. And ma'am, thank you so much for making time. We understand you're traveling after this. I can't afford to Rishi. If we could request all the panelists and everyone to gather here for a group photograph, please. Along with Roy and ma'am, please, before the panelists go back to their seats. Time for all cameras to be up, photographs to be taken. Thank you so much. I would like to request